Welcome, everyone, to this webinar, Promising Practices for Promoting Flu Vaccination During COVID-19, a panel discussion. My name is Laura Maynard, and I'm with the Lewin Group. Today's session will include presentations, followed by a panel discussion and a live question and answer time with the presenters and participants. This session will be recorded, and we'll be posting a video recording along with today's slides at the link that's on the slide in front of you now, resourcesforintegratedcare.com. The audio for the presentation automatically streams through your computer, but telephone lines are also available. You can access that telephone number if needed by clicking on the black phone icon at the bottom of your screen. This webinar is supported through the Medicare Medicaid Coordination Office at the Centers for Medicare and Medicaid Services. MMCO is helping beneficiaries duly eligible for Medicare and Medicaid have access to seamless, high-quality health care that includes the full range of covered services in both programs. To learn more about current efforts and resources, please visit our website or follow us on Twitter for more details at integrate_care. At this time, I'll give a little bit of background information on our two panelists for today. Brad Lucas, MD, is the Chief Medical Officer for Buckeye Health Plan. Formerly, he ran a large obstetrical gynecology office in Cleveland until 2007, when he joined Buckeye Health Plan full-time. He continues to focus his clinical work in specialty areas of practice, including preterm birth, low birth rate, and infant mortality. For Buckeye, Dr. Lucas manages a team of physicians responsible for reviewing claims and authorizing treatment, and developing programs and relationships with providers to effectively improve health outcomes for Buckeye members. Our second panelist today, Denise DeCardenas, is Plan Lead and Executive Director at First Choice VIP Care Plus. Reporting to their President of Medicare, Denise serves as the primary contact and the face of Medicare to the South Carolina Department of Health and Human Services and the Centers for Medicare and Medicaid Services in support of the dual eligible products for AmeriHealth Caritas family of companies. In this role, Mrs. DeCardenas collaborates with the President of Medicare to develop and implement strategic initiatives that ensure company growth, as well as ensuring that member needs are well served with a strong emphasis on quality operations and innovation. Our learning objectives for today's session: we will identify strategies for establishing and leveraging flu vaccination committees. We will describe ways for gathering member input on vaccination outreach and communications, and identify strategies for messaging and promoting flu vaccination in the context of COVID-19. We'll also identify opportunities for partnering with community organizations in flu vaccination delivery. And now we have an outline for today's event. Following our introductory polls, we will share some great CMS resources to support your promotion of flu vaccination. Then we will hear from Buckeye Health Plan and First Choice VIP Care Plus, sharing their approaches and strategies related to flu vaccinations. Then Dr. Lucas and Mrs. DeCardenas will join in a panel discussion on planning for this flu season during COVID-19, followed by answering some questions from you, the participants. So to begin, let's use a couple of polls to get an understanding of who's attending the webinar today. The first is, in what setting do you work? Please just choose one of the options provided to let us know which setting you are in. We'll give you just a moment to click on that so we can get a sense of who's with us today. Okay, let's get some sense of those responses. By far, health plans are represented the most. with a few with us from home care and from community-based organizations. And then our second poll, we would also like to know your professional area. You could click the poll response that best indicates your professional area. We would appreciate that. Pick one of the options provided. All right, click on those. Let us know your professional area, and we'll see what we have. So lots of case managers, lots of health plan administration folks, but some also from other providers, physician assistants, nursing, medicine, and some from customer service, a few from pharmacy. Thank you all very much for letting us know. Thanks for sharing in that poll. We'll now move quickly to highlighting some of the flu vaccination resources that are available to you. As a result of the COVID-19 pandemic, vaccination rates have declined, putting communities at an increased risk for preventable illnesses like the flu. The Centers for Disease Control and Prevention, the CDC, recommends that everyone 6 months of age or older needs a flu vaccine. CMS has published an array of resources to support you in promoting those flu vaccinations this year. Making sure that people of all ages keep getting routine vaccinations or start getting routine vaccinations like the flu during this COVID-19 pandemic will help protect people and communities from preventable diseases, and it will therefore help reduce the healthcare system's burden. So we encourage you to use and to amplify the CDC's messages about the flu shot's importance, emphasizing that this is another way people can stay healthy, particularly now. So CMS has developed a toolkit to help you stay informed on materials that are available about the importance of the flu vaccine. And these are materials drawn from CMS, from CDC, and from HHS. The toolkit is designed for clinicians, for Medicare and Medicaid beneficiaries, and for the general public. And it's located at the link that's presented on this slide. We will also be adding this link and the links on upcoming slides into the chat box for your reference so that you'll easily be able to pick them up there. There are a number of social media resources that are available both in English and Spanish. CMS is doing a campaign focused on Medicare beneficiaries through these various social media channels. And some of the graphics on these slides today are from that campaign. This flu campaign emphasizes vaccination benefits, access, and that flu shots are covered by Medicare and Medicaid plans. A partner social media kit and toolkit graphics in both English and Spanish are available at the links on this slide, and those links are now being added to the chat box as well. So the resources at the CMS Office of Minority Health, their link have resources that are categorized to be used by healthcare professionals, partners, and the general public. And these include links to learn more about Medicare coverage and links to the CMS Flu Vaccine Partner Toolkit. The link for those resources is there. And CMS has also developed and compiled materials to assist partner organizations in promoting flu vaccinations, including language for advocacy groups and grassroots partners, for long-term services and supports providers, for clinicians, and for group practices. The toolkit also includes materials for Medicare beneficiaries and CDC materials for consumers and partners. They have draft newsletter language, draft blog language, draft Facebook posts, and draft tweets that you can use. And those resources are all found at this link on this slide. That will also be put in the chat box. These campaign materials include postcards promoting flu shots, available in many different languages, including those listed on this slide. And a link to the postcards is there. Message on these postcards: now more than ever, everyone needs to do their part to prevent the spread of illnesses like the flu. In addition to all of this, CMS has also developed a checklist that will help health plans, providers, and community-based organizations in reviewing their existing approaches and identifying additional strategies for promoting flu vaccinations for members, providers, and the care team. This checklist is on the Resources for Integrated Care website at the link posted on the slide. So as we move now to our panel discussion, our panelists' presentations, I'm pleased to introduce Dr. Brad Lucas, Chief Medical Officer at Buckeye Health Plan. Brad?
Oh, thank you very much. Thank you, everybody. On the first slide, I want to share a little bit about Buckeye Health Plan so you can get a sense of who's sharing this information with you. In Ohio, Buckeye Health Plan is the second largest statewide Medicaid managed plan. We're growing quickly. We have 425,000 members, 25,000 dually eligible members, over 38,000 providers. It speaks to employees and agency partners there. We're really located around Ohio, and we're on all products, and we've been in service in Ohio since 2004. Our program, we label it Fluvention, and we've focused on and targeted high-risk members who have worse outcomes when they do have the flu, recognizing that across the board everybody should get an influenza vaccination outside the age of 6 months. Above 6 months, but there's been some targeting. At the beginning of COVID season, we did quickly try to educate our members on some of the commonalities and differences between the two. The aim certainly is to help members prevent the spread of both flu and COVID-19, and Fluvention includes education materials, as I've described. Due to increase in targeted outreach, the high-risk members report higher flu vaccination rates than our general member population, which has, last year was a 24% vaccination rate. We did see a 52% vaccination rate among members 65 years and older, and a 39% vaccination rate among those with chronic conditions. To educate members about the availability and benefits of flu vaccination, we conduct direct member outreach that includes text messages, outbound calls, interactive phone messaging, mailers, and landing pages. Then community outreach, media outreach, interviews, PSAs, newsletter content, social media, infographics, and provider outreach with toolkits and in-office posters. And we've enjoyed partnering with some large pharmacy retailers to expand access to vaccinations. Walgreens provides flu vaccinations during Buckeye member events, including farmers markets, and CVS reaches out to Buckeye members to encourage them to get their flu vaccination at Minute clinics. Thank you.
Thank you very much for that great information. We appreciate that. And now we will introduce our next panelist, Dionise DeCardenas, Plan Lead and Executive Director at First Choice VIP Care Plus. Dionise?
Hi, good afternoon. First of all, thank you for having me. I really appreciate being included to share this very important topic with all of you. So we're First Choice VIP Care Plus. We're located in South Carolina. We're also a part of Select Health of South Carolina, which is also a part of AmeriHealth Caritas family of companies. AmeriHealth started in 1983 in a West Philadelphia hospital and is a national leader in healthcare solutions for people who are at low income level and are chronically ill. Today, AmeriHealth serves more than 5 million members in 13 states and the District of Columbia. Our plan is a Medicare Medicaid plan, and we joined the Medicare Medicaid Financial Alignment Demonstration in 2015, which is also known as the Healthy Connections Prime Program in South Carolina. We serve the dually eligible population for both Medicare and Medicaid, ages 65 and over. Similar to Select Health of South Carolina, it's the oldest and largest MCO in the state. We are the largest MMP in South Carolina, currently serving about 75,000 members. Next slide, please. So we began planning our flu season in early May. In general flu seasons, we've looked to our CAP survey to help guide us. We look at claims data to help guide us to determine vaccination rates from the prior year. This year, we had an extra added concern given COVID-19, and we started our work group much earlier this year. Although we do plan our flu outreach and strategies the year prior after lessons learned. This year, we focused on our high-risk members. We tried to reach out to them first, not only for the flu, but also for COVID. So we wanted to make sure we were educating that group first. We used a variety of outreach strategies. So we did sustained outreach, which included strategically timed letters. We did phone calls. And we also did postcards. Later this fall, we're going to include an It's Not Too Late messaging. And we hope that this will help remind folks that, even if it's late in November or December, it's still not too late to get their flu shot. We've reinforced all of this messaging to through our members, also with communications with our plan staff. So not only our care coordinator team, our community health navigators, and also our call center staff would understand the messaging in case they were asked questions. And we also updated our flu vaccine messaging to address the concurrent risks of COVID-19 and the flu. For this first year ever, we also started a gift card incentive with the hopes that we could bolster our flu vaccination rates. Next slide, please. We also incorporate member feedback on flu prevention programs through our Member Advisory Council committee meeting. At this meeting, we have numerous members from our leadership team and many of our members, some who have been with us since we originally started this MMP. So we really appreciate all the feedback that we receive from them. We've also invited the South Carolina Department of Health and Environmental Control in the past to provide training, and also for our MAC and our First Choice leadership team. We are also reaching out to them this year in the hopes that they can come to our MAC meeting once again to provide needed education to our MAC members. We also hold conversations with our MAC committee members to understand the concerns around vaccinations. We had a very good dialogue, not only about COVID-19, but also about concerns about flu vaccinations at our committee. So we take their comments very seriously and take that back to then reprioritize and strategize our communication methods. We also developed a flu mythbuster flyer. We are finalizing the review also for this year, so I'm happy to share that with everyone. We didn't have it in time for this seminar, but I can share that after this meeting. So this flyer was developed based on feedback from our MAC members and also from the CDC website. We go to the CDC as a source of truth just to make sure that we're gathering the most up-to-date information on common myths about the flu.
Thank you, Denise, for sharing that. That was great information. And now that we've heard those two presentations, we'll go into our panel discussion and begin with a question that I'm going to pose to both of you, but I'm going to ask Brad if you'll answer this one first. How has your messaging and approach around flu vaccination changed in light of COVID-19?
Thank you. The messaging is similar as the typical flu years, but the COVID-19 pandemic really has provided a unique opportunity for messaging around public health, as well as reminders about the availability of existing flu vaccination. So members are more aware now that their individual decisions have an impact on community safety, and the vaccinations are an effective way to protect themselves and others in the community.
Thank you. And Denise, what would you add to that as far as your perspective there from First Choice VIP Care Plus?
So as I mentioned earlier, all of our members are the 65 and older population, and we know that population has a disproportionate risk for COVID-19 and the flu. And even without COVID-19, this population is greater at risk for complications should they contract the flu because they risk pneumonia and hospitalization. Adding to that, they can also have chronic conditions, diabetes, hypertension. So promoting the flu vaccinations early and often becomes more critical, especially now. So given COVID-19, it was crucial to educate our members that flu vaccinations will reduce the risk of flu-related hospitalizations, and that will in turn reduce the risk for developing COVID-19 in a hospital environment. We let our members know also that a flu vaccination is a step towards reducing the risk of becoming very ill. Again, I mentioned earlier we did new this year an incentive monetary gift card to help folks get their flu shot. And then in prior years, our messaging on flu shot postcards, we mentioned multiple preventive health measures, including annual exams, but messaging this year was solely focused on the flu vaccination. We also worked on reinforcing our messaging with care coordinators in order to prepare them for questions that members might have related to the flu, including questions around the safety of getting a flu vaccination during the COVID pandemic, and also myths around that. You know, understandably, questions from members are more prevalent this year than in previous years. We've listened to that feedback and also reinforced our messaging related to that.
Thank you. Thanks so much. Okay, for our next question, we want to know how you all have partnered with organizations and providers in your community to offer alternative locations for flu vaccinations. So, Brad, we'll call on you first.
Oh, thank you. Yeah, really utilizing clinics and local pharmacies, Walgreens, CVS, independent physicians, to get that flu vaccine delivery. Like I described earlier, in local farmers markets, getting flu shots to individuals there. And then CVS has been employing outgoing messages to our members to remind them to get their flu shot, such as calls, texts, and MTM types of messaging. And working with providers to bring the vaccine to older adults in assisted living and retirement communities in order to provide health education at the same time as the vaccinations.
That's a great approach to be able to do that education at the same time as the vaccination would be very helpful. Thank you. And Dionese, would you answer this one? How have you partnered with organizations and providers in your community to offer alternative locations for these vaccinations?
So before I get into the provider piece, I want to mention that CMS has been an important partner in this effort also. This year they reached out to us, and with their help, they sent out flu vaccination postcards to all of our members. And I really think that is important because it's not only just us telling members about the flu and the importance of it, but they're getting this messaging from very reputable sources. They're hearing it from CDC, they're hearing it from CMS, they're hearing it from their providers. We help members get a flu shot from a provider of their choice, although we've had some members who are concerned about leaving their home. They're concerned about getting COVID in provider offices, and so given COVID had drive-throughs to get testing done, we thought, why not have a drive-through flu event so that members who are concerned maybe about stepping foot in a provider office, we can direct them to those specific spots. So we've been doing that, and we've also partnered with a major hospital in that effort as well in some of our target counties. But, we just want to try to emphasize the fact that, just because COVID's happening, if somebody's concerned, there's a way for us to get them to that flu shot. Also, our primary care providers, home and community-based service providers, and our community long-term care waiver partners, they're also assisting in promoting flu vaccinations using their own messaging.
Thank you. Thank you. Our next question goes back to something that both of you mentioned in your presentations. This will be a chance to dig in a little deeper on that and share a little more about it. But this is what strategies may have been successful in dispelling myths about flu vaccinations. So, Brad, could you speak first?
Yeah, sure. Thank you. We, too, developed a toolkit for providers to assist them in dispelling myths, including a flu versus a COVID-19 fact sheet. We have member-facing materials, additional resources for the members. I feel like saying some of these things over and over, and COVID has allowed us maybe a little bit of a different platform to really stress things and hope that it maybe makes more sense this year than ever before.
Thank you. And Denise, how about you all? What strategies have you found to be successful in dispelling myths about flu vaccination?
So, as I mentioned earlier, our population is an older population, and we needed to understand why they might be hesitant in getting the flu shot. So we asked our members at our member advisory committee. We heard such feedback like, the shot will give me the flu, or I do not need to get one every year. And we dispel those myths because, the CDC gives some helpful information on this. The fact is the flu shot can't give you the flu because it's made either with flu viruses that are not active or with no flu viruses at all. Also about not getting one every year, the fact there is that the immune system protection from the flu shot gets lower over time. So a yearly flu shot gives the best protection against the flu. But despite all that, folks still have strong core beliefs. We've received this year some heartfelt thank you notes for offering the incentive to get the flu shot. We also, interestingly, got a note thanking us for that as well, but, also saying they would trust and pray they would stay well. So it's really important to, respect people's beliefs, but to continue to provide them the education that's available out there and just to keep reinforcing that. We want to make sure that we take that input from our MAC member advisory committee because that helps enhance our cultural competence in developing the messaging about the flu vaccine. I think we all have, certain thoughts about it, and we want to make sure that we're hearing those thoughts from our member population. We also educate our care team on the responses to these common myths, so they too are prepared when they get member questions related to that. And I just want to stress also, care coordinators, they're encouraged to listen and respect the concerns of our members, including when they have religious-based hesitations and anti-vaccination beliefs, and it just reinforce that education.
Thank you. Thanks for sharing that. And we want to, before we ask our next questions of our panelists, we want to turn the tables a little bit and ask our attendees to begin typing into the Q&A box what strategies you may have found to be successful in dispelling myths about flu vaccinations. That would be great if you could just type that in. It'd be very, very helpful. What have you found to be helpful in getting past these myths about flu vaccinations? And also, what have you found to be helpful to promote flu vaccinations? What strategies are you using now to promote flu vaccination among your dually eligible members during this year's flu season? So just start typing some of those into the Q&A, and we will come back and read some of those out once you've typed them in. Our next question for our panelists is specifically for Denise. What's the role of your flu vaccination committee, and how does it help you with preparation for flu season?
So this year, our committee is really a subgroup or work group of our leadership team, and that's led by our chief medical officer. We included this year probably more folks than usual, but we included from all our lines of business for Medicare, our quality team, medical management, our long-term services and support, and other various leaders to provide feedback into this work group. To evaluate how we did in prior flu season activities, evaluate the current temperature, especially with the pandemic, and we applied lessons learned in planning for the upcoming season. We gathered input on different messaging modalities. How should we do it? Should we use a postcard? Should we do a letter? Should we do phone calls? And we decided to do all of them. I think, in prior years where we might have, done a postcard or, a newsletter, this year we really went at it from every angle we could possibly think of just to make sure that members got this messaging. We even received feedback that they appreciated getting all of that was good education that they got. We also reviewed information from the CDC. Our chief medical officer was really great in providing us the latest in journal updates. We also discussed the timing for implementation, and then We relayed all of this messaging back to our associate to interact with our members.
Thank you. Thanks for sharing that. And then our final panel question is for Brad. How do you customize your messaging on flu vaccinations for different member groups?
Oh, thank you so much. Yeah, if you think about the high-risk members and those that we focus more on, so pregnant women, children below age 5, above age 6 months, adults over 65, and individuals with chronic conditions. At this point now, kind of like DNA described, pretty much anything that we're developing and any avenue or method of communication, we are mentioning influenza vaccine. It doesn't go untouched. There's every opportunity we take.
Thanks for sharing that. All right, we're going to take a moment now to move to that chat function where you all are typing in your responses. So we'll take a moment. If you haven't yet, please enter your response as to what strategies you're using to promote flu vaccinations this year. And let's look and see what we've got so far. What are some of the things that you're doing? Being upfront with members, telling them there's still a possibility of getting the flu even when you get the shot, but that the level or severity of sickness is likely to be greatly reduced. So using that messaging. Differentiating the product, the shift from egg-based to help with egg adaptation and help with overall vaccine effectiveness. That's a great point as well. During this year, I've been telling my members that it's really important, since COVID is also out there. I hate for them to get the flu and then get COVID on top of that, or vice versa. So I encourage the ones that always refuse the vaccination to really consider it this year due to this. I've only had a few continue to refuse. That's been a successful strategy. That is great to hear. Also coming in, creation of a flu toolkit for member-facing teams to assist with educating members and addressing common myths. Those great CDC resources, used those to help with common myths and utilize that information as a source of truth to refer members. Excellent. Also, member incentives, member and provider education, and the flu vaccine or prevention that will help alleviate any added burden or confusion with COVID as a competing virus. Yeah, I see another comment related to that one, attempting to separate flu versus COVID and how important it is to address both. Include a message when clients call in on our IVR on the importance of getting their flu vaccination before they make an IVR selection. Adding that message in there. Let's see. Working with clinics. Stickers created and passed out. So using stickers at the clinics, working with local mom and pop pharmacies on a poster. So a really good local approach there that would likely be very helpful. Very similar responses, postcards, flyers, calls, use of the CDC toolkit. Have sent out info to providers through the newsletter on how to have strong conversations about the flu. And have also researched local clinics in the area and posted them on our internal website so care managers have the information at their disposal with any member contact. Someone else mentioning postcards. Keep those great strategies coming in. If you've got anything different from what you've heard so far, or one of these that you've used that worked really well for you, go ahead and type that into the Q&A, and we'll read it out for everyone. Just looking for others. Oh, here are some more. Yeah, listening to members' concerns, providing facts, and then respectfully allowing them to make their own decision. That's a wonderful approach. Very patient-centered, very person-centered, great approach. Is someone else using doctor blogs on your website and your Facebook page, using that to educate. And here's someone else offering a drive-through option. Okay, so a drive-through option to obtain the flu shot without getting out of their car, since many report being fearful to leave home due to the pandemic. All right, looking for others. I'm going to double check. Yep, reviewing those key CDC points. Collaborating with local pharmacies and focusing on vulnerable housing authorities by setting up mobile flu clinics. Promoting a safe place to ask questions and debunk myths by finding credible research and resources for information. Education and support from the team who have developed a rapport with the members. So using folks who already have that rapport with the members and having the message come from them, that's a great strategy. Collaborating with facility, LTC, regarding HEDIS measures and prevention strategies, that's a great idea. Flu reminder flyers in multiple languages. Using evidence and statistics, yes. Messaging to people, protect yourself to protect your loved ones. Great. And I see that some of you are typing questions into the Q&A pod as well, so please continue to do that too. If you have questions for our panelists, and type those in while we're also looking at the strategies that you're sharing. So I take it to a personal level and talk about how my 98-year-old grandmother gets a flu shot every year. And I think this is a big part of why she stays so healthy. So sort of personalizing the message. Sending text messages, another way. Okay, getting lots of good questions coming in as well. I'm just looking to see if we got any new strategies being listed. Yeah, flu reminders and text messaging. Offering doctors on-call services, have a doctor visiting at home and perform the flu shots at home. Making it easy and convenient to get vaccinated. Offering drive-thrus as well as vouchers for them to get shots at a local Rite Aid, social media campaigns, text messages, and direct mail invitations to those drive-thrus.
Laura?
Yes.
I have noticed just a couple questions here. If you don't mind, I can answer some of them. I know Lisa asked, is there any way to know which of the interventions was most effective? We did hear back from our MAC committee members that they really liked the postcards because they didn't have to open mail. So we too sent a letter out from our chief medical officer, similar to one of the other plans that mentioned that as well. But they really, the postcard was the key. It is hard to collect immunization data from cats, especially for our population. A lot of them will have Alzheimer's, dementia, so you're going to have to depend on caregivers to fill out that information. So you have to look at claims data. But I'm trusting this year with the incentive. We've already received, just in our first week, we got 300 letters back from folks saying that they received the flu shot and showing us proof of that. So I think the incentive was probably the key. But, check in with me next year and I'll let you know.
Great, thank you. And we are going to move on now into some of our Q&A time. And so thanks for answering that one. Also wanted to ask if either of you track racial and ethnic disparities in flu vaccine uptake among your members. Do you track that? And if so, have you planned any targeted outreach or interventions to address any disparities?
So we don't track the racial ethnic disparities. We try to focus on first and foremost, chronic and high-risk members, waiver members, so we base it off of health conditions. That said, we work really closely, even though transportation is carved out for us, we work very closely with folks who might be, in rural communities or even in local communities. If they can't get to the provider office because they don't have a car, can't afford transportation, we make sure that they get to where they're going. We ask other related social determinant of health questions, also just to make sure that folks can get the health care that they need.
Thank you.
Yeah, I would agree. We don't track to see which races and ethnicities receive the flu vaccine or not. I think understanding that is certainly important. We're beginning to understand that better related to COVID. So COVID in its own way is shedding light on so many ways that we might do things differently in the future. So that I can see that finding a terrific place to help us understand.
Great. Thank you. Thanks for that. And Brad, I had another question that came in for you during your presentation. You mentioned a number of different elements of that fluvention program. Do you have a sense yet of which of those interventions may be most effective at this time? Are you seeing better results from any one or another of those interventions?
We've used fluvention as a program over the years, and it gets kind of redesigned and hopefully improved every year. I don't know about exactly this year. We did see improvement last year, but I'm going to give you a prediction. I think the more that we can assist providers in their messaging is something that will move the needle. Or when we have individual care manager conversation with individuals who struggle with problems, and they're understanding those and develop, they have that engagement at that moment, and they're talking to them about the influenza vaccine. I really believe in not missing an opportunity and dispelling those myths at that moment. I'm in the habit of doing that with everybody I cross paths with now, and again using the COVID pandemic as a platform to say, look at where we are with COVID. Influenza has a vaccine, and it's capable of the destructiveness of COVID. It has a vaccine, and we need to really be mindful of that now.
Yes, thank you. And thinking of that sort of in this COVID context, too, I'll ask the both of you this question. Have you heard from members that they feel already protected from the flu because they're already wearing masks, they're already social distancing, so therefore they don't really need a vaccination this year? Are you all hearing that? And if you are, how are you responding to that?
So I haven't heard that, but that is certainly interesting. I know that we've heard, with social distancing, it'll be interesting to see at the end of this season what the flu rates are compared to last year. But, we need to dispel that myth, wearing a mask, and of course it depends on what you're wearing. It can help you from spreading illness to others, but we probably need to dispel that to say, unless you lived in a bubble at home and never went outside and never talked to anybody, you might be fine. But if you're going out at all or interacting, folks have grandkids and, their kids go to school and they come home. So, we need to dispel that myth as well, just to reinforce how important it is to get the vaccination. That's really the only way that can help prevent the flu.
Yeah.
Yeah, and I agree. We want to move away from having to live our lives in respiratory disease lockdown, and moving the direction, allowing that as a reason to not get the vaccine, it's going the wrong direction.
Yeah. Great. Thank
But
you.
I've not heard that. We have not heard that yet.
So you haven't heard that particular one either? Yeah.
No.
So a question for Denise. Not everyone has engaged their advisory councils to gather feedback on flu vaccine campaigns. Why did you decide to engage your advisory council? And what recommendations do you have for plans who would like to engage their advisory councils and get member feedback in this way?
So we tried something. So given COVID, obviously we couldn't have our usual in-person meeting, and this complicated things. So we decided to try using member Zoom. Of course, after all the things were protected and password and all of that, had to go through a lot of reviews to ensure that we maintain privacy in these meetings. But we decided to use member Zoom to get folks to come and attend our meeting. And I was really shocked about our turnout. It was, I think this year our meetings have just been really, really great and fruitful with the feedback we've received. It was definitely hard to get members to use Zoom. Again, our population, some of them are really tech savvy. They loved it. They got in right away. Others, we had to work for an extensive period of time with their caregiver, because you have to enter a password and a code. And so it was complicated. But, just because you can't get out there and meet folks face to face, you really have to think of other ways to get them to come. And we also try to make it about them. Instead of having leaders talk, we always ask them what they think. And, once you get them talking, they just love to share. And again, since some of our members have been there since the beginning, a lot of them have formed friendships and relationships over time. So they like to talk amongst themselves, too. So I find that just to be very helpful.
That's great. And how did you specifically get them to give you feedback on their thoughts about flu vaccination or helping you understand community concerns about flu vaccinations?
We just ask.
That's great. That's always the best approach.
We ask. It's as simple as, even with our COVID messaging, how did we do? Is there something that we could be doing better for you? What did you like best? What didn't you like? We try to ask from various ways, and they answer.
Excellent. Thank you. Shifting just a little bit, Brad, I wanted to ask you one of the questions that had come in from one of the registrants, and that's in regard to guidance you provide to members who may have a medical reason for avoiding the flu vaccine, such as people with allergies or others who might have a medical reason to avoid the vaccine. What messages do you provide for them?
Well, we are going to direct them to their doctor to have that conversation. The medical reasons are few, and I think that when somebody's sharing that with a care manager or somebody else in the plan, I think it still tells me a little bit of a fear of the unknown, still not feeling confident enough and needing more conversation with a doc. And it is an individual decision. And I think differentiating, what's a side effect of a shot is important. I still hear people say, well, I was sore for a day or two, or they felt like they had some disease from the shot, when it's a side effect of the components of the shot, and just always helping, understanding and helping with that health literacy of overcoming that.
Yes. Excellent. Thank you. And as we move into some of the other questions, I do want to remind attendees that you can continue to chat questions into the Q&A box, and we will still have a few minutes to take additional questions. So if you have another question, go ahead and type it right on into that Q&A box. And kind of related, Denise, I wanted to ask you a somewhat related question, in that Brad was mentioning member fears, concerns, and kind of listening to address those fears and concerns. And someone had noted that you had some great comments, Denise, about being open and respectful to members' beliefs or concerns. How do you coach and or train your care managers or other plan staff on that kind of communication?
I think, first and foremost, our care team, they're nurses, they're licensed social workers, they're counselors and trained to listen to member concerns. So I think it's important to do a lot of listening and, understanding where the member's coming from. Our goal is not to tell a member that they're wrong in their belief. You don't want to do that. You need to respect, where they're coming from, how they were raised, cultural beliefs. I think the important thing in our role as caregivers, nurses, licensed social workers, is to educate our members. In doing that with CDC guidelines and the source of truth from the CDC, I think that speaks volumes. I know I've heard some folks using kind of personal stories. I've got my flu shot today, or I've helped my mother get the flu shot. And just kind of explaining a personal, story, positive story about getting the flu shot. I think that that's helpful as well.
Yes. Thank you. And I will ask both of you, have you adapted your flu vaccination strategies for homebound members who are unable to leave their home? How are you addressing that? So, Brad, I'll ask you first.
I would say when we identify the need, certainly we make an allowance and arrange for the benefit of if somebody can get out to the home to give that, we would do so. And if it's a matter of transportating somewhere else to get the flu shot, but we prefer to have it at the home, and we arrange for the home nursing home visit.
And we do the same as well. So if we had a referral for somebody who could not leave their home, we would make sure to get somebody out to them.
Excellent. Thank you. And Brad, we had another question come in for you related to, you had shared about text messaging, and that text messaging was one of the approaches that you had used at Buckeye. Are there any considerations to share around text messaging? For example, do you have any concerns or considerations around gathering consent from members for this?
We are moving, so there's a number of options as health plans become more sophisticated at being digitally connected to allow you to do this, and where you open up a mobile connection with your members. So we're trying to get away from a care manager directly texting a member, and more towards a larger percentage of being digitally connected and safe, HIPAA compliant fashions. So I would say, working with vendors who, and there's just more and more of them, and more, so we're exploring that, and that, I think that will be the finally a way that we all, better engage our members.
Excellent. Thank you. And again, sort of on that topic of logistics and all, Denise, we had some questions come in about the logistics of the incentive for the flu vaccines. Things like, what's the monetary amount for the gift card, and how do you confirm that the member got the vaccine, and how and when do they get that card?
So we can confirm with claims data. There are various ways to confirm, but we have on the actual incentive a validation to be filled out that the person got the flu shot at whichever office they went to. One of the problems that we have is that with all the free flu shots everywhere, sometimes you just can't capture that in your claims data. And again, CAPS at the end of the year, it's a survey. Questions asked of folks, in the spring. They might not remember if they had their flu shot back in September. So we validate it that way. Our gift card incentive is currently at $20. I believe so. We have many this year, so forgive me if I'm off by $5 on that one. But it seems to have been working. I mean, I think with this particular incentive, we got a huge response related to that. I know someone asked a question about how do you fund that. We have to fund that ourselves. But this is such an important thing, and to me especially, it's an important responsibility for the health plan to ensure this type of preventive care. It's really just so simple, so easy. It protects our vulnerable population, so it makes sense to support that financially.
Thank you. Thanks for sharing a little more detail around that. And I have time for one more question. I'm going to pose it to the both of you, and Brad, I'll ask you to answer it first. What have you learned from promoting flu vaccinations that might be helpful to you later in promoting a COVID-19 vaccination were one available?
Oh boy, just that I'll tell you, I think the level of still fear and distrust in individuals it's kind of still easier to think about figuring something else out later, or committing to something else later, or understanding something better later. Having fear of medicine is really powerful and really human and normal. And so we're in a situation, right, that's really unique, really unique, that we all hope that there's a vaccine for COVID. And here we're getting back into the flu season where you might think, okay, 100% of people are going to get a flu shot now because they've seen what's happened to COVID in our lives. But I'll be fascinated to see what percentages, how the percentages change with the influenza vaccine this year. So I guess the message is we need to keep working harder and harder to understand and have the compassion that folks have fear, and keep using that to guide kind of our interventions and conversations.
Wonderful, thank you. And Denise, what have you learned from promoting flu vaccinations that may be helpful to you later?
I think just in general, the pandemic has really opened a big awareness for this year. I've learned it's just, we're with the pandemic for the unforeseeable future, so we need to continue this messaging into next year. I've learned that it's important to, seek feedback from our members to see how we're doing, not only on flu messaging, but also on any COVID-19 messaging, because you could be sending messages out into the universe and not knowing if it really truly is having an impact, a positive impact, or if you're bombarding your members with too many messages. So I think it's important to continue getting member feedback, and also to continue the importance of promoting the flu vaccine. I really hope that next year it doesn't just, die down, but that everybody, CMS, DHHS, all the health plans, everybody kind of teams together to continue this type of promotion.
Thank you very much. And I want to thank you both for being our panelists today. Really very much appreciate it and express great gratitude to you for that. Want to let everyone know the slides for today's presentation, a recording and a transcript will be available on the Resources for Integrated Care website soon. And very importantly, all of you, don't forget your own flu shot. Receiving your flu shot is more important than ever this year. I've got mine. Next slide is your evaluation form. Thank you all for joining us today. Please complete the brief evaluation of the webinar so that we can continue to deliver high-quality presentations that meet your needs and your interests. The survey will pop up on your screen following the conclusion of this session. If you have any questions, please email us at ric@fluent.com. Again, thank you so much, all of you, for attending and participating. And this concludes today's webinar.